ALL is the most common childhood cancer. We're pretty good at treating childhood ALL. 80% of patients are cured of their disease, but there's another 20% of patients that's not cured of their disease, and that's the patient population that urgently needs new therapeutic options. One of the goals in cancer research is to understand the addictions that the cancer cell has. And so if you can understand what the cancer cell is addicted to and then target that addiction, ideally you can eradicate the cancer. And this is the best example of this is probably with chronic myeloid leukemia, a leukemia that happens in adults, where the driving oncogene, the cancer's addiction, is a gene called BCR-ABL, and a drug has been developed to target that gene, and it effectively controls the chronic myeloid leukemia in those patients. And so if we can find other addictions in cancer cells, then hopefully we'll be able to also effectively control these different diseases. And so in ALL, what we're trying to do is to identify more cancer addictions, and in particular in a patient population that has a high risk of relapse. Our research is really laboratory based, and what we do is query the entire genome in an unbiased fashion. And we do that with what are called shRNA libraries. And these are a tool that we have to inhibit every gene in the human genome, and then ask which of the genes the cancer cells are addicted to in very specific contexts. And so in our project, we're asking the question, if the Ikaros gene is mutated, what does the cell become addicted to? We're studying Ikaros because Ikaros mutation is associated with a high risk of relapse. We think that this research can be incorporated into future clinical trials because we are querying the entire genome. But when we do it, while it's an unbiased look, we are taking a very therapeutic perspective on the results. And in fact, some of our previous experiments have identified druggable targets and are likely to lead to a clinical trial for AML. And so we feel like that by uncovering molecular vulnerabilities in cancer cells in specific contexts, we may be able to identify therapeutic targets that we can then incorporate into clinical trial design.